Welcome back. Our look at the impact of a degenerative brain disease, Parkinson's disease, continues. News 2 newsman Scott Orr is willing to take a life and death risk to hopefully change his life, giving us a rare snapshot behind the scenes, a look at what it's like preparing for life-changing brain surgery. We want to warn you, some of the surgical procedures are very graphic.
I've changed my mind.
Sometimes in life,
oh, there you go.
It's our friends who help us through.
You got a helicopter landing pad.
They understand when others don't.
Oh, oh, oh.
And cheer us up.
Scott, did you at least wash your hair before you did this?
When we are facing the unbearable.
Yes, I did. I didn't want anyone to get my cooties.
For Scott Orr,
I wanted to keep my ear if we could, because I'm going to need that afterwards.
who has Parkinson's,
Ow!
getting ready for brain surgery
It feels a lot cooler.
becomes a party,
To me, he still looks like Bull from Night Court.
a head-shaving party,
It looks interesting.
surrounded by 18 of his closest friends
Oh, it's cold.
You ready?
I'm ready.
and family,
Oh, wow.
many colleagues from News 2,
No blood yet.
It's really chilly up there now.
here to celebrate his life.
Does it make me look older or younger?
Younger.
Rewind to just days earlier, where we take you back to day one of the brain surgery process. Scott, along with his support system and wife Shannon, go in for an MRI.
I'm beginning to have the start of the problems that you have as things progress, where you have problems moving.
First, a snapshot of the brain to know what they're dealing with.
Well, the surgery offers me a chance to have a better quality of life for as long as I can before things get totally out of control.
Diagnosed just 4 years ago with Parkinson's, in just a short time, Scott's life is much different.
This has always been thought of as a disease that old people get. I'm only 42 years old.
His tremors have gotten worse, and he hopes that this brain surgery stops that.
I'll be right in.
Because he's shaking so much, his arms have to be strapped down with a pseudo-heavy straitjacket.
He doesn't realize that he thinks his tremor goes away when he goes to sleep, but it doesn't.
Yes, hi, John McVicker. How are you?
The brain scan is sent over to neurosurgeon Dr. John McVicker and neurologist Dr. Rajiv Kumar for analysis.
So it's going to be something similar to that.
Before surgery, doctors will drill 3 holes in his head to hold a tripod of sorts during the surgery.
There's a little screw that passes through this, holds it.
But like any surgery, brain surgery has its risks.
The worst thing that can happen, which is a hemorrhage into the brain that might, or over the surface of the brain, either one of which might require an emergency operation.
But it is a risk Scott is willing to take after medicine didn't work.
And when patients don't have an adequate response, or the response is complicated by adverse effects, then deep brain stimulation can often be a very helpful adjuvant therapy.
The whole process is trying.
We'll be doing consultation to help the whole deep brain stimulation team understand whether or not you're a good candidate for this procedure.
Scott also meets with a neuropsychiatrist to make sure he doesn't have any pre-existing emotional conditions which could be made worse with the surgery.
I am pretty nervous about today because anything that has the word test associated with it, you can fail.
Scott passes a screening with flying colors, but because of anxiety of having the disease and the anticipation of surgery, he is put on anti-anxiety medication. Fast forward.
You know, you think about a lot of things when people are cutting your hair off.
And back for the finishing touches.
Scott, you're done.
At Scott's head shaving party.
He's like he's Conehead.
Now they can put screws in my head.
His parents, watching over by webcam from Arizona.
Oh my God.
And now it becomes clear.
Oh God.
That this surgery.
This is what I'm gonna look like?
Is all too real. 2 days later.
This is the day we're going to put the screws in my head.
The surgeons must implant fiducials or screws for the surgery.
And if you don't think that's scary, the idea of having screws put in your head will give you a good shake.
It's going to be a stick and a sting.
Even though the injection is a bit painful, Scott won't be able to feel it because they numb his head by an injection.
This is so funky.
When the doctor is done with the implants, they wrap his head and send him in for an MRI.
Today isn't bad because I know it's not much of a procedure. Next week will probably be harder. And as long as his cognitive doesn't go away, he'll be happy. Somebody's messing around with your head. It's when that starts to get bad that he'll get really distressed. He would be better if you put him in a wheelchair than if you take away his brains.
Coming up, fear of the unknown.
I think you have to be a little nervous. I mean, they're drilling a hole in your head.
As Scott heads into brain surgery.
Oh, it feels funky.
He is awake
Do I actually have a hole in my head?
as the risks are real
Are you okay? Still dizzy?
and the outcome is uncertain.
There is a chance that this may not work for me.